Nigeria, we have these three diseases are common in not just the states, but across some of the states in the country. And I'm speaking to self-transmitted hepatitis and then schistosomiasis. And how did we get to this point? There was a baseline survey. We did at the beginning, before this program commenced, in 2009 and 2017, there were surveys that were conducted to check for the presence of these diseases. And in Ogun State, during the 2009 mapping activities in the state, the report showed that 14 LGAs is endemic for salt-transmitted illness, the roundworm, intestinal worms and worms. While in 18 LGAs, we also found out that there was schistosomiasis in those 18 LGAs. So you can see that Ogun State has a high disease burden. This disease that we've been treating since 2017 is very high in Ogun State. So for the 6 years, and you know, we have been, for the past 6-7 years, we have been providing medicine to children in school. Some of our Ntds here, even our education secretaries, our ZDOs have been collaborating with us to ensure that the school-age children between the ages of 5 and 14 receive this medicine. And so now, at this point of impact assessment, we're saying that following all these treatments we have been doing in Ogun State, we are now ready to conduct this assessment in this month of May. And what is the main goal? Are we together? Yes. What is the main goal for this assessment? Like it was earlier noted, we want to determine, we want to go back and remap. So at the beginning, the results showed that 14 LGAs has SPA and 18 LGAs has schisto. So now we're going back to where we assess. After giving the children medicine for years and years and years, following the WHO protocol, we're now going back to those LGAs to check if these diseases still exist or not. And from that result, we'll be able to make a decision as to what level of treatment we'll be doing in this LGA going forward. So for evidence action in partnership with the Federal Ministry of Health and the State Ministry of Health, Education and Children, we are going to be, for this assessment, we are going to be using a standard laboratory analysis and model-based geospatial approach for this, to conduct this assessment in the 20 LGAs, this statewide selection, right? And this approach will basically be for both surveys utilizing, we are going to be paying attention to the existing surveys. We are also going to be looking at environmental factors. These are to help us also consider environmental factors. We'll be looking at a pre-existing survey, results from the past surveys. We'll also be looking at FDA coverage. What has been the warning treatment? What has been the warning treatment coverage in the past? To make a decision as to what level of disease still remain present in the state. Next slide, please. So for the assessment, right? Starting off with the objective, we want to go back and map the disease body in the LG. For the design, we are using a cross-sectional design approach with the site selected for sampling. Specially use the regulated design for better predictive. This is a summary of the approach we are using. This is model-based geospatial approach. That's we call it scientific or scientific approach, right? Then for the sampling, how are we going to move into the schools to collect the samples? Then from the schools we move to the lab. So for this exercise that will commence next week, we are targeting 40 schools in these 20 LGAs. It means that for each LGA, we have selected 2 schools. These 2 schools, in each of these schools, we will be collecting urine samples and fecal samples. There are schools and the and in each school visited, because we are also going to be looking at the youth, the site selected, each of the schools in all the LGA and the community. For each of the schools, we will be collecting samples from 50 to 60 students, children beneath the age of 5 and 4. I'm sure our education stakeholders are also taking. And these children must be between 5 and 14 years old. Are we together? Why are we taking the urine and the stool sample? Because we're checking for 2 diseases: schistosomiasis and Ntds. Those are the 2 work infections we are checking. So, like I said, two sites are selected across most of the LGAs. I think we have just a few LGAs and 1 or 2 LGAs that we don't have 1 selected. But 2 sites in 1 LGA, 60 children per site, and these 60 children will be giving us their urine and stool samples. We will be training, we have trained field officers, yes, personnel, field officers, lab laboratory officers that will be moving into the schools with support from the Ntds and the education focal points, who will serve as local guides to the schools. We'll be moving into the schools to collect the samples. Now, in the case where we get to, thankfully, our state team, working with the NSTDs and the education stakeholders at the LGA level, have visited the schools already selected. And as I speak to you, community mobilization and sensitization activities are already ongoing. So can we appreciate the NSTDs? Now, in a case where, as we commence the sample collection next week, in a case where we get to a school, and the school is a bit hesitant, or we believe that our NSTDs and our education focal persons have done a great job. So we will not see instances where schools are rejecting or saying they are not involved or they are not interested. And thanks to suburban education that have also stepped down their letters, official communication concerning the impact assessment. But in a case where we get to a school and the school is a bit hesitant or the pupils are saying they are not interested, we have also sampled an additional school that will serve as a buffer, that will cover if the first school is not available or does not accept the exercise. But I know in this hall, and with the work that our NSTDs and education departments have done, we do not have cases of refusal or rejection. So we have in each, under each one, we have 2 schools. One is the main school, and we have the buffer school. And then we would also want to understand, because water, sanitation, and hygiene also contribute to the prevalence of these diseases. We will also be administering questionnaires just to gather information as to how the environmental factors and water, sanitation, and hygiene in schools and within the community affect the the prevalence of these infections in school age children. Next slide. So what is the work plan we are working with? Our work plan. We started with a 1-day national planning meeting where we brought together stakeholders at the national level, Federal Ministry of Health and Social Welfare, and the partner and some other key officers met. This activity has already been completed. Following that, we conducted a state-level advocacy. The Federal Ministry of Health came down to the state, and after that advocacy, we progressed to education and SUBEP to also conduct advocacy working with the state. That exercise has been completed. Following that exercise, education and SUBEP now stepped down official letters to the schools and LGAs involved, activity, again, that activity has been completed. Immediately after, once we got the communication from education and students, we started the community sensitization and mobilization activity, which is also ongoing. We have a WhatsApp coordination group where we're seeing the very good work our Ntds and education focal points are doing at this time. And we really want to appreciate them for that. So the community mobilization and sensitization activities are currently ongoing. And then we have some schools where they have also requested for consent forms to be completed. That's also in place. So this activity is ongoing. Today, we're having our one-day stakeholders, state level planning meeting. And this meeting is to sensitize and get the buy-in from all our stakeholders. We have stakeholders from our traditional leaders, from the community. So because beyond the engagement in school, we also want the community to be aware. They need to be aware of these key activities so that should there be a case of rumors in the community, you can quickly step in because you were at the state planning meeting to say, no, we are aware of this activity. There is nothing negative about this activity. It's for the good and for the interest of the state and the children, which is why we had to bring in this wonderful group of stakeholders here. So after this planning meeting, what will be the next step for the Federal Ministry of Health, the State Ministry of Health, and the cabinet? We will be moving into training a field team. The people that will now be moving down to the LGAs and those that will be working in the lab to make sure that the samples that the field team collect from the schools are moved quickly to the lab and analyzed and the results documented. So that training will happen. Now, I really want to highlight that this field survey team will be for all the LGAs, will be working closely with the NMTDs and the education professionals. Why? Because you are the food soldiers. You know where the schools are. The community is your own. So we will be relying on you as our local guide as we move into the field to commence sample collection and the lab analysis. And then once we have completed this 3-day training, we will now move into the field exercise. This 3-day training is planned to start tomorrow and end on Saturday. And immediately after Saturday, the field team will now move into the community, into the first instance, into the first zone, where we will start collection of samples. So this chart just shows us the distribution of the zones and how we will commence the field activity. So for all the LGAs under zone 1, you already know that this is the first zone we're starting with. So we're starting with Ikene, Ijebu North, Ijebu Bode, all the Ijebus, Remo North, Odebolu, Ogun Waterside, all the Ijebus, Ikene, Shagamu, they are all under this cluster 1, zone 1. So this is the first zone we're starting with. And by the time we conclude with this zone, so these LGAs under zone 1, you already know that your zone is the first zone we're going to visit. And on your WhatsApp group, we'll be communicating to you the sequence, which are the LGAs. For each day for the sample collection, we have 6 teams that will be visiting 3 LGAs. So 3 LGAs will be completed each day. So on your WhatsApp group, I'm sure the state coordinator, after this planning meeting, we will be confirming to you the first 3 LGAs will be visiting under zone 1. After zone 1, we move to zone 2, which is E4. In E4, we are visiting 3 LGAs, and those are the 3 LGAs. I know you have Oloko and E4. Then zone 3, we have the Yoruba, the Ethiopia, and then the last zone will continue to move, and then return back to Abio. So Fabiometer is the last zone where we will be selecting samples. So we have, yes, I have come to the end of my presentation. We will now move into discussion, questions and answers.
Before discussion, there is a very brief omission. The room is missing.
Yes, I will also apply twice. Yes, so we'll correct. Thank you, sir. So moving to questions now. Questions. In fact, from the community members and leaders here, we want to hear from you. I want to hear from you. How will you ensure that this exercise will not fail in your community? So let's start from you, sir. Please, I want to know your name.
Thank you very much. Thank you very much. We are with you, and we are going to give you all the support needed from our others. However, I want to ask a question. How will you ensure that the samples that we collected from schools, there won't be resolved? The sample is collected from A, from B. How will you ensure that B is not given to A during the results? Did you get that question very well?
Thank you so much. Please come here.
Come on, don't want you to learn how to cook.
One house so that we can.
That we involve
Looking at it after this.
because what we are saying now, where
House, please.
meeting the parents of these students in the schools, just to sensitize them, then educate them on this important exercise. You see, somebody that gets the opening prayer and opening speech the other time said, people will say they want to make money, they want to. If parents are not well educated on this issue, they will not allow their work. Yes. So, what we are saying now, after this, you may give us time so that all parents, teachers, all schools involved, so that we may educate them on this issue.
Okay. Thank you very, very much. Very much. So let me start from your own before I address yourself. So I said to you that 2 weeks ago, the NNTDs and the education focal officers have already started the groundwork. And I think it would be good to call on the leadership of the NNTD or what speak about what they have done so far at the community level, just to make sure that everything is But since 2 weeks ago, community mobilization and sensitization have started. They have started this across all the 20 LGs. And they have been meeting with for all the schools selected. They have met the head teachers. The head teachers have also sent down messages through the PTA, the SDMC, and then some have also reached out to the parents. Your consent. And then so a lot of work is currently ongoing around community mobilization and sensitization. Education and students have also stepped down letters to the school because the Ministry of Health stepped down the letter with the list of selected certificates. And they have also done the same to the lower level. So thank you. Does that answer your question, sir?
Answers my question. Because I can't remember whether I was given the list in the book, but yes, I know those.
That's second
okay, are you giving me this? The list of the schools.
It doesn't cost.
that's but I need the list.
Okay. Okay, thank you very much. Thank you very much, Daddy, for your comments, sir. We are also going to project the list of schools that are being selected in each of our local governments. Then also the student focal person and education focal person. I remember the letter they shared with me. The list of schools was being attached in the letter that was being shared with the zonal education officer. But aside from that, we will also project so that the schools are not many. It's just 2 schools and 2 buffers. So in case one school doesn't meet up with the number of samples that will be needed, so we can use another school to augment that. Then regarding the mobilization, I would like Mr. Yaya, 3 of our entities to speak to that rather. Mr. Yaya, Mr. Ojo, and the Ado local government, the administration. She was at a PTA meeting on Saturday, last week Saturday, to address the parents regarding this prominent side. So after your comments, allow them. Okay. So thank you very much. So just speaking to your questions, a very, very important question. Now, as part of the field team, we have the group we call sample collectors. Sample collectors are the ones that will work with the teacher to collect the sample of the children and put in one house, so that we can defend this outside and we can tell, spread the news. So sample collectors will collect the urine sample and the stool sample in a bottle. That bottle will be clearly for every child that his or her sample will be collected. We have the people called recorders, the group of personnel called recorders. Those ones are going to take each child's information on a tablet. So there is an electronic questionnaire they have. They will enter the child's information and create a unique ID. If it's not number 001, child 1, number 002. So each child will have, and as the children are coming back with their sample, because we will give them the bottle, as they are coming back with their sample, they are labeling it with their unique ID. So there is no case of mix-up. Can you clap for us? So there is no, to allay your fear, there will be no, in fact, Federal Ministry of Health is here to train all the field team that will be collecting these samples, collecting them with support from evidence action, and to make sure that yes, we are deploying capable hands to the field, so there will be no mix-up.
Thank you very much.
Yes.
Thank you very much. I want to appreciate everybody involved in this program. It's for the betterment. Why can't we have something like that? So that why can't we have something like that? So that all of us, at least we know we are talking of trust. And everybody, just like our sister said the other time, government of the and the rest of that. So that trust can still be there. If the reagents and every other thing they wanted to use that thing can be brought to the center, let them do it, get their sample, and let them move. So that will go a very long way. It will help us in subsequent ones. Thank you so much.
Thank you very much, sir. Let me give you.
Thank you very much, sir. We all work in the hospital. You can write for this for you. They'll give you result of once. This one come back in 2 days' time. Meaning that they need to go to that one. The LF one, they don't put on the rapid kits. The blood will take the result. This one will look at the rapid kits. This one they have to prepare the slides and read under microscope and that. And we cannot carry microscope and since 12 lab scientists to this school. and system where we think is going to do. This one is done in the lab, it's not a lab doing something. Most of those lab skills we have like what they use for that way, they tell you really they will but I'm going to think and bring out and say positive or negative. If the playing the slice and really on my will not be done in this way.
So the next step is innovation is still, we will get there as a country. Yes, but the innovation, we haven't gotten there. But there is room for all that. I think we have one question that has.
I should finish my body. Have you finished your presentation?
Yes, I have.
No.
Yes.
Thank you, sir. Hello, sir.
Hello.
Hello, sir. Like the federal ministry of health this exercise has more quality control to the service. Come to you, sir. That's quality control check. And the quality control check cannot be done. That's why we have a dedicated lab for certain cluster. If a microscope tells me that, oh, they are saying, I have to confirm whether that report is positive or negative. If it is positive or negative, I snap that slide and upload it online. So it's the more rigorous, but we have to also bring in quality control. If I will send people previously in the field because of fatigue, they will say negative. Some people will also say positive, and they are either deemed. They will say it is negative. So it's that quality control that makes it that they will bring all these samples to a lab. And in the lab, they are all used. So it is not just only one person. We have 12 microscopes covering one area. So if you say they bring something from a data lab, the 12 people will read those 60 and 60 school classes. And I will also personally look at all those 120 before we got on the data. Are you getting that? So that's why that is the information we need for this to get that. We are not taking this anywhere, but it's for quality control. Because at the end of the day, we want to say that we say it's free, or this local government is free, and we change the narrative from 14 and 18 to either whatever result we will get after the session. Thank you.
This is the last question. Our time is fast spent.
We want to appreciate the huge especially on mobilization and implementation of these programs. Still hammering on the community feeling about the taking away of samples of urine of soil into that culture. Ìtọ̀ àárọ̀, ìtọ̀ àárọ̀, it goes along.
ó yàtọ̀ sample ló fẹ́ gbà ń sìn.
It's part of what we
Nǹkan tó ti ń ṣe bọ̀.
and enlightening
tó bá ti lọ́wọ́ mídìí ẹ sọ fún ọkàn
parents
kò sówó sọ.
about if you
Ọmọ
make my
ọgbọ́dọ̀
child
heavy.
school dey pay and the next
kí ló
day
tó kó tó kó pé sí tó
she come shivering àjẹsíkà ọmọkùnrin lóde ọmọkùnrin kò
Àmì.
wọn àjẹ àná ló bá ọmọ yẹn having said that we have support and participation of every stakeholder
Ọ̀rọ̀ láìsí. Tí ó bá ṣe fídíò tó jáde,
however
community mi,
when
wọ́n ṣe gbà
we
láìsí
also
tí
be
ó ṣe
very
wọ́n.
very
Nígbà tí àwọn kan sọ mọ́ this ló post ẹ̀,
many
tí fídíò
others
náà jáde,
this is
wọ́n á
our
ṣe bí lókà ni wọ́n.
millions of people asking us they came to our office say ṣé àwọn tí wọ́n fẹ́ kí wọ́n fẹ́
Àwọn ènìyàn wọ́n kàn fi
disseminate the population Africa ọdún yẹn.
tó wà lọ́tọ̀ yẹn wà.
I want to tell us this that you need to convince us or confuse us
ṣẹ́rí kìíní àbábá
that
ayé o.
this is not about disseminating African population by way of sterilizing upcoming generations. There was a film going about and two parents came and told them mama told them no this is I was in an endemic I came from endemic where Custodian brigade when children in village the last drop shows blood and it is this program that was specifically mounted in that area at the day. And this the work of yes, and even the river of our street was wicked. So we need more enlightenment so as to disabuse community or society's mind against negative propaganda.
Thank you. So, I just want to remind us that for the past 7-8 years we have been working. So the thought behind this is that the community also knows is aware of the work. Yes or no? So that will be a starting point for
Láyé àwọn ọmọ
our
Yahoo.
engagement,
Láyé àwọn ọmọ
especially for
Yahoo.
our traditional leaders, our ES,
Ọ̀rọ̀ àti gbẹ̀.
be a starting point for discussion. We have been working for the past how many years. Now we want to come and check if the disease is still there or not.
Thank you, sir, for that scenario. We call everybody. We have a lab. If you are part of that local body, you are free to also be in that lab. It is not a hidden thing. This exercise is taking the field work is taking to a lot of so if you have a microscope here, people are you will also see it. That's why we are showing you that we are also going to show you the lab we are using. In our paper they are using FUNAL's lab. Department of World and Affairs can come here. But in terms of theology, there is no way you can remove old modern things from everybody. And somebody can just come up with one story and just do them. But the point I want to say is that he said Southwest. Southwest are 8 states. including water. So,
Fèsì iṣẹ́ yẹn wọ̀ náà.
so they cannot, if it was the negative way, we would have gotten information from Oyo and all the other way.
Ògùn yàtọ̀.
And this one is on now. There are some other communities in mobilization. And all of that. This is just for fiscal. We are going to come back again for. We are going to come back again for. So please who has given the money they want to eliminate entity. In Nigeria, they have over 19. They are not focusing on the ones that they compete for over a long period of time. I don't come back from a meeting now. 22 states for uncle are free now. So, if you don't do this assessment, you will not know the status to give that particular local. So it is for you that know to tell the people. They may not believe you today, but tomorrow they will believe you. Thank you.
I'm just adding that the states that have gone through this assessment, reassessment, will not be receiving medicines anymore or as usual to treat. And like you said, you're from an endemic community. You can and you keep the disease out of the yeah, so it's ownership, collective ownership. We come together.
Neighboring states, how was it? Always time
Yorùbá ni wọ́n sọ, ó lè bá ìlú wa dáadáa yékéyéké. Láti nígbà tí àwọn ọmọ tó jẹ́ pé wọ́n bá tọ̀tàn lè láti sọ tí wọ́n bá tọ̀ ní ilé ìgbèrè jáde, wọ́n wá fún wọn lóògùn, ṣé ẹ̀jẹ̀ ń ṣe jáde? Lẹ́yìn ìgbà tí wọ́n ti fún wọn lóògùn kò sí mọ́. Lẹ́yìn ìgbà tí wọ́n ti lògùn kò sí mọ́. Lẹ́yìn ìgbà tí wọ́n lè ti tú ìṣòro wa yẹn, àwọn tó ń lọ síbẹ̀ wọn ò lè tọ́ ìtọ̀ ìjẹ̀ mọ́. Ìyá ló pẹ́ fún ọ náà. Ìyẹn ló máa tí ó kún ní wa ní ìṣe tó ṣe jẹ́ wípé dáàdì yìí wà ní. Gbogbo àwa other stakeholders wa wà ní. Gbogbo àwa ta wà ní òwú láti tí wọ́n dá sáǹdì ìbọ̀tà fẹ́lẹ̀ ṣe ní ìfúri láti ní problem tàbá ti ní. Èyí sí problem because àwa la máa serve as coordinator in our various local governments. Níṣì la máa ṣe bí ọba pé iṣẹ́ tí wọ́n fẹ́ ṣe yìí, iṣẹ́ tó máa ń wá àǹfààní bá gbogbo aráàlú. Àtọmọdé àti àgbàlagbà. I say earlier that the children are most vulnerable to this disease. Ó ń ṣe àwọn àgbàlagbà náà. Lọ́dẹ́dá ní Yewa North, ní Abẹ́òkúta North, and some other moderately endemic health disease, àwọn àgbàlagbà náà wọ́n lọ sí stroke. Àwa ti ṣiṣẹ́ lórí research torí physiogenital schistosomiasis tí wọ́n bá tètè treat schistosomiasis ló máa ń padà fa ìdíwọ́ fún àwọn obìnrin. Ó máa ń fa kí oyún bàjẹ́ lára obìnrin. A ti rí èèyàn tó jẹ́ wípé lẹ́yìn ìgbà tó lọ pàṣẹpà tẹ̀ wá lẹ́yìn ọdún mẹ́wàá tó fi dúró tí ò lọ́wọ́ tó lọ́nà tó dá lóhùn. So we are advocating for all our support. The stakeholders get present. Kábàáwò lọ́dún pé ìtọ́ wọn fẹ́ lọ fi ṣòwò ní tí kò fẹ́ ṣe ètò àtìjẹ́ nǹkan ẹ̀mí ni. Òtúndé kó jẹ́ pé iṣẹ́ tẹ̀wá gbà ní àti ká mú káàkó pọ̀ mọ́ra wọn. Jáde kọ́ sọ̀rọ̀ nípa reagent mi mọ̀ bí sáyẹ́nsì jáde ṣe sùn. Thank you very much, sir. So ó ní ìkọ̀tà máa ká dìbò ìgbẹ́ yẹn. Tọ́mọ àti sínú sky of àwò lábẹ́ microscope club ṣe sọ. Ẹni la fẹ́ wò. Sọ̀rọ̀ mi yẹ ọ́dọ́ ìlú tó bá yẹ pé ìtọ̀ lásán la fẹ́ gbà ní. Àníkọ́bá ti fi matrix aṣọ positive. Tó bá positive ló máa jẹ́ ká máa hàn pé àwọn òkè ní fífò. Àwọn ẹlòmíì wà tó jẹ́ wípé ìtọ́ wọn ẹ̀ẹ́dẹ́gbẹ̀ẹ́ ìlú ẹ̀kọ́ wọ́n ní ẹyin schistosomiasis yẹn lára. Ṣó ti yé tó ìdílé yẹn? And thank God, another way to allay our fears, you have our media person there. Manifa Street, she has been so supportive to the NTD unit.
mọ̀ pé ká tó kúrò nígbà yà máa rí ṣe ọwọ́ wọ̀ ṣẹ́tìrí fídíò tí wọ́n ń lò yìí OGPC is also here. We also have platform times. Because of our budget, we should have bring up all our media personnel. But we believe that with these three that we have engaged, they are going to disseminate the information to our parents and to every other stakeholder. So I hope there is nobody here in this room that is not seeing any fear. Maybe we are going to reduce the population of Ogun State. See, if we have anybody that wants to reduce Ogun State population, they will not use this method. They will not collect food, they will not collect, they will bring food. Oh, they don't like they were nice people come. Oh, they don't reduce the global war. All of my guys, so anything that has to do with health and safety, and support Ministry of Health. Thank you very much, sir.
Sorry, we are rounding up because of our time. So for the lab, for those who are interested and asking where will the analysis be done, when we collect the samples and we go away with them. So for zone 1, the Kenya General Hospital is where the analysis will happen. The microscopists, the lab team will be seated in the general hospital there, and you can come and peep and see what the analysis going on there. Then under zone 2, the E4 axis, we have E4. I think the state hospital, not general. The state hospital. Okay, thank you. So it's the state hospital. Then same as in Laro, and then for Abeokuta is now. So if you're in that, or if you want to come and see what is happening, this is where the stool samples and the urine samples begin. So we've come to the end of this session, and we will hand over to you. So I think we very important.
Àwọn bàbá wa láti community pé ẹ ṣe ẹkú ìdílé sà ẹ jọ kọ́tà fẹ́ ṣe lẹ́yìn sọ pé ó ṣe pàtàkì tó afẹ́fẹ́ jọ fẹ́ bá wa báwọn ọ̀dọ́ wa sọ̀rọ̀ àwọn youth leader àwọn youth in the community because nǹkan tó ṣẹlẹ̀ lóòdò ó máa ṣẹlẹ̀ ní òkú because gbogbo àtàdé àwọn community ní àwọn youth tó fẹ́ kí wọ́n ṣiṣẹ́ the youth leader all those young people they say so in fact. Where after we collect the sample, we have to seize the samples from them. In fact, they want to beat. They even said that they want to boot their vehicle of place. So it's God that made them to escape. And they escape the action. So we have to do a kind of a lot of consultation, a lot of begging. Still, some of the community did not allow us, but the youth. So please, sir, help us involve youth so that allow.
Thank you very much, Mommy. We are in Ogun State. Where are we? We are in Ogun State. We are in Gateway State. We are enlightened. Are we not enlightened? We have praise. We have our education secretary there. We have our donor officers there. Our Ntds are here. Our analysts is there. Private schools are here. Lima is here. Han is here. What happened in Ondo State will not happen here by the special case of the Almighty Allah. We have Ogun State standards. When the list of stakeholders were sent to us, we see this. Because we know stakeholders that are relevant to this activity, and we have every one of them here. We did not have media on our list that was being sent to us. We incorporate it. We invited 3 media, that's of like 18 or more that we have. And I believe they are going to share this information. We have a platform for our media personnel in Ogun State. Media personnel that support ATV programs. I believe the Malaysia will send it. I'm very sure platform time we also send on that page. Mr. Dawood is on the page.
OGPC is also our friend in the state, so we are good to go. No parent will reject that the child should be sampled. La hawla wala quwwata. Àti wà nínú iṣẹ́ yìí ó ti pẹ́. We have suffered a lot in terms of physical education control program. So we got the intervention. Before the statewide intervention, we are lobbying. We are leveraging on other programs. So here we are, we to see where we are left and where we are presently. Whether the CISO and the SDH are still within us. Oyewa, after model of privilege, after more, that's it here. So the external and Owarana. Nítorí pé àwọn àrùn yẹn tó wà lára àwọn olùkọ́ tó máa bí ọmọ ajẹ́rìí ni. A lè gbogbo ẹ̀. Iṣẹ́ tí wọ́n mi máa ń ṣe in academic performance of our children. A ti sọ̀rọ̀ female genital schistosomiasis, the ordinary Brazil quartel, obìnrin yẹn kàn sí under the government to work. So we are going to succeed, and we are already succeeding. What's
You have something to share with us, so let's get from you, sir.
Well, this bill of recognition is not new. That is one. Somebody came from Funab. A woman came from Funab to use it as a PhD project. I was the official chairman there. I called the parents and I discovered them, and the man came and was so another man came when I became the leader of this same and it's not new. They have been coming to use as a project, and the parents have been allowed them to take samples of this other things to use as a project. There's no problem. As a bit of a
Thank you so much.
For that, please.
Allow them, what they have done so far, regarding the
Aside the mobilization, I want to talk about mobilization. As this is not straight to us, right? About 2 weeks ago, I led a team from Funab that went to 3 schools. For this similar thing, okay? For this similar thing we are about doing now, we went to 3 schools. One at Ode, one at Ajura, and one at Ulemon. We went there was no problem because there was mobilization and sensitization. I led the teams that went there myself. We took their samples and there was no problem. But the truth is, so we mobilizing them, I will pray that there will be no problem. Okay, God helping us, there will be no problem. Thank you very much.
Yeah, once again, I want to greet every one of us. As far as we are concerned on the aspect of mobilization, I think we are by all our ES and other stakeholders here. We can't do it all alone, and that is why we are all invited here. In the aspect of substance, I think some of the researchers from that also came to my area. It was a community issue. We are not even visiting schools. I think with my team, we actually took almost about 150 samples within the community, and there is no notice. Because we are able to actually tell the community the reason why they have to take these samples, and they also get back to us with the result of the 2 samples they are taking. So we should be rest assured that by the grace of God, with every one of us involved in this very project, especially all our EAs, our professor from Kuna and all other researchers, the LFTD, the State Ministry of Health and Education, let's agree here we may have successful projects. Thank you.
Thank you for all these words of encouragement. I think there is no state in this country that Shisto studies, they've done Shisto studies than Ogun State.
So we don't envisage any. That's why you're here to own the thing. If the thing is your own, I think we'll all say okay. And we've been studying all over the years to not have any bad report from this state, and it will not start now.
Amen.
Thank you very much for all the words of encouragement. We are far behind, please. Let's hurry up so that the item number 12 now, let's see the list of the schools. Yeah. Let's see the list of the schools and all the ES and representatives of the local government areas, please pay rapt attention. If the school they selected is in a place that is security compromised, you let us know. All these things are not cast on stones. Please pay rapt attention. This is very important.
Okay. Now, let's quickly look at the code. Now, for each local government,
Please, let's pay attention. These are the sites.
for each local government, we have 2 words selected for each local government. For Abeokuta North, we have Totoro 1 and Sabo 2 selected as well. And for each ward, we have 2 schools. We have one main school and then we have one proper, as I been saying. So let me see the one now. For Totoro 1, under Kakura, we have AUD, let's see the other side. We have AUD as the main, AUD school 1 as the main school. And we have been told our target is 60 pupils. So we have AUD as the main school. In case you are able to get 50 pupils from AUD, then we move to the next, which is the buffer. And that one is
How is this one doing now?
It's trying to.
This is here now.
now for the first word, we have AUD as the main school. There we take our sample. So if you are able to get 60 pupils in that AUD, hello, now please. Now, if you are able to get if you are able to get 60 pupils from that AUD school, there is no need going to buffers. Or in case you are able to get 60 pupils from AUD, then we move to the next buffers, which is what only to limit this. That is for the first appeal standard. For sample to the second one, the next one is BMA. I think you have the full name of BMA. BMA school 1 is our main school. Please, let's have the full name. So we have the full name. So our main is Basholu Oshish Abiola School 1. Why the proper school it was is Olumo Primary School. Basholu Oshish Abiola. Double O. So the best school is Basholu Oshish Abiola School 1. Then you have the proper school as Olumo Primary School. So let's go to Abeokuta South.
And you see that each school has been assigned a UID, a unique identification number. Yes, for the sampling. So all the children under that school will have that unique ID assigned to them.
Okay. Now for Abeokuta South, we are using Imo word, two words, Imo and Ibara 2. And for Imo, we have Imo Methodist Nursery Primary School as the main buffer, as the main school. Why Mount Mercy Nursery Primary School is the buffer? As I said the other time, our focus is to main school, but in case we are not unable to get the number of people, we go to the buffer. So, the same thing also goes to the same word, which is Ibara 2. We have St. Anne's Primary School as the main school, and then our Lake of Apostles School as what? As the upper school. Now, for Adodota now, all the schools Adodota, they are private schools, and we will love to talk about our zone education officers. For Adodota, our main school is Adedoku International School. This is the main school. It's a so we don't have any property. So let's
we must by all means go to these two schools to get our sample. So we must make up all the sensitization and engagement with these two schools. Because yes, I trust you. We're just reminding ourselves.
And I think it's important to stress that over the weekend, they had a PTA meeting at those that also addressed this.
Okay.
I was very close.
Okay.
So for Ewekoro, we have. Not our so it's that let's do this. We do the word.
I just noted down.
So for Ewekoro, we have Obada 2 and Itori as the word that has selected. So for Obada 2, we have Owi Community Primary School as the main school, while we have Olumo Primary as the buffer. Then for the other one, we have Stakeholder School, Ola Akeke as the main school, Ola Akeke as the main school, and Ajekule Ibadu Community Primary School.
What's BDS? What's BDS? Baptist Basic.
That is for
Basic, what's basic?
so let's take a look at that. Now for info. FACA. Under Itori 1. Say for FACA. Okay, so let's go to the other side. Now for info, we have Ilepa and Boka as the two ones that are selected.
So, and the name of the main schools are AC School 1 in Lepa. We have BDS. What is BDS? Baptist Day Primary School. Then the other buffer is the other buffer school is Salvation Army School. That is the buffer for the second ward. Now for Ijebu we have Ajebadele 2 and Ajebadele 1 as close as the one that are selected. And the main school are community primary school alone.
You have this second school in Ifo.
Let's go to the for Ifo. Now, hello, one house please. For Ifo, for the second word, you only have one main school that is for party. Okay. Now, so let's go to this. For Ijebu, I have said, we have Ajibadele and Ajibadele 1 and 2 as the worst rated. So we have community primary school load as the main school. For Ijebu, if you don't have a proper for second or first word, is that right? Yes. Okay, thank you. Yes. For the second word, we have community primary school in Ade 4. And we have Savior Primary School at Ibadele as the buffer school. Is that correct? Yes. Okay, let's go to the next one. If you are good notes, we have Agotu and Mamu as the word selected. So for Agotu, we have Primary School at Ibadele as the main school, and Asaroku Primary School, Moshosh as the buffer. For Mamu, we have Leslie Primary School, Mamu as the main school. While we have St. Peter Primary School, Mamu as the buffer school. Is that right? Okay. For Ijebu North East, we have Imowuro and Ogogo. Okay? Ogogo and Imowuro, so as the word selected. So for primary, for main we have St. Michael Angela Primary School, Ojideyo. Thank you. So while we have the community primary school as the buffer school, for the second one we have West Primary School, okay, as the main school, and Ilewo community primary school as the buffer school. Okay. For Ijebu, we have Imopaiyoro and then Imepe as one selected. So we have set Augustus Primary School 2, Campus as the main school. While we have Otubu, Memorial Primary School. Where's the location? Where's the location of that Otubu? I think you should have Okay. Now, for the second school, for the second word, we have Emmanuel Anglican School 2. Idi, Odiolowo. Let's get close. It's Odiolowo, not Odiolowo. While mostly primary school, Olowo. Okay, as the buffer school. Is that correct? Yes. Let's go to next for Ikene. So we have Okere 2 and Okere 1 as the selected word. So we have Oshite Memorial College Junior as the main school and Okere Community High School as the buffer school. Then the second one is Little Scholar Islamic Primary School Hegari, where we have this secondary school as the buffer school. Is that right? Okay. For Imekwa, we have Diani and Ilara as the word selector. Ilara as was selected word. So for we have only Nurse and Primary School Ode, and the Methodist Primary School 1, Ilara. While for the Baba School, we have Miracle Nurse and Primary School 4, and Methodist Primary School 2. Is that correct? Okay.
India is not a word. Ode is name of the word.
Okay, so let's take those.
Yes.
Okay, so let's like Ode Idiani. Now, Ode. Okay. Then for Ethiopia, we have Yubo Ilashe and Itiroko as word selected word. For the main school, we have Ethiopia local government school, Ilashe, and the community primary school are very good as the main school. But for purpose school, we have Nigeria Customs and Primary School and the Zion African Church Primary School. Oh, sorry, we have community primary school, Joko, and Nigeria Customs and Primary School. Thank you.
Who have population in that school?
I think that there is a lot of Nairobi school. The element is the gap. The element is the gap. This is you. For that having squad. For that custom, we have population there. That's the population. So she's confirming what we have there. So next one is Obafemi Ode. So for Obafemi Ode, we have Ekete Ashipa and Ode as selected word. Now for the main school, we have NUT school, Magba Kozu, thank you, and Zion African Church Primary School as here as upper school. For the second one, we have all state primary school 1, Ode, and they'll say Peter and Primary School will be done. Okay, thank you. For Odeka, now, for Odeka we have Alabata and Odeka as the selected one. Now, on the Alabata, we have CSC Primary School, Alabata, as the main school. Therefore, upper school, we have Community Primary School, Larry Ondo. Larry Ondo. Olorode as the upper school. Now, for the second school, let's under Odeka word now. I think this is where you have to addition. Any primary school, Garamo Bashi, Basi. That is where we have. So you have to set that one down. Then we will replace that one with the Methodist primary school, other than local government school. There is that one that is an issue that we have to set it down. So it's not going to be 5 that was selected. Now, for the second, please, this one is word 15 and word 15. We need the name of the word.
Yes.
Also, going to 15. Okay. Now, so for now, are we having one word in last?
Yes.
So for the only we have one word selected for the
Ready fẹ́ kó gbọ́mọ̀ sọ.
So, is 150,000, but we need to get the name of that word. And the name of that word is Ogo. Because
Is a word. That's it.
now from Ntds, we have two selected schools as they go from primary.
You say what?
Did you not see that? That's not it. It's the primary school,
Noted. It's been corrected. So we take just like this. This was what 11. Okay, now for Otogolu, we have two words. That is Ogo and what the other one? That's the name of the word.
We have looked at it.
What are you looking
That is what I'm saying.
Let's move forward.
Now, I think you get that. Okay, now let's forward aside. Now for aside, we have only one word related to water side, and that is a way. And for that way, so we have community primary school here, and the St. Peter Anchor Primary School as the main school. While we have
excuse me, I don't think the same word.
Yes.
They are in the same word.
There is one school in our ward, one on our ward, the ward, the Momo.
Going back, let us see.
Yes,
Now, for water side. Hello. Water side.
Yes.
Okay. Now, for water side, we have community primary school. It will be and St. Peter Primary School as the main school. Then for the buffer, we have say Zito High School.
one house, please, one house.
And it will put form and paper company staff school. Is that okay?
You cannot say okay or no, because you put it now.
That was
But there are schools in that word.
that's okay. That's okay. Now let's go to Rehoboth. For Rehoboth, we have Ishara and Ikala as selected board. And for the main school, we have local government school, Lushi, and the local authority school in Para. Then for the buffer school, we have St. Peter Basic School, the world, and the United Primary School in Para. Is that right?
Observation.
Okay.
Observation, yes.
In Water side, I have visited Wisdom Nursery and Primary School because that was the name of the school that was given to me when we came for the planning. Now it's not here now. This Wopipop Pampers Secondary School, I did not visit that school.
Hello. What are I want to ask a question. Now, this school that we have there, is it part of the school that is it part of the list that was given to you? Is it among those 5 schools that was given to you?
Part of the 5 schools given.
Yes, part of the 5 schools that was given to me. But I speak with Mr. Ademiwa and I visited the Wopipop St. Kizito's Junior Secondary School, then Community Primary School, then St. Peter's Primary School, then Wisdom Nursery and Primary School.
But see what you said, you visited Community Primary School.
Yeah, no, I'm talking of the Wopipop and paper. I did not visit that school.
Buffer schools.
But don't worry about the buffer school. You visited this main school. These are the main schools now.
You will be and
Yes, the community and St. Peter. Yes.
Don't worry about the buffer school. And they gave you their consent.
Yes.
That is fine. We're okay.
so next LJ is Shagam. For Shagam, we have Sabo to Alomido
Where is Shagam?
as selected board. Is there? Now for Shagam, the main school local government degree Sabo and Asaru National Primary School Olomido. Why the other schools are local government primary school one Trinity and Moro Community Primary School, right? Okay. Year 1 notes. Under year 1 notes, we have a Bute Goro and a Tata Now, for the first school, we have year 1 notes to my first school. And dance school and the base school. For the cover school, we have hello, one house please. We have community primary school and the Alakedi primary school as cover school. Right? Then for year 1 south, we have Ilaro and Ajulete as selected road. Now, for main school, we have, it is royal it's royal. We have royal Ntds primary school and St. John primary school too as the main school. While for Buffer we have Yewa College and the AUP primary school and Jinebe as the Buffer school. Is that right? Okay, thank you. Those are the selected sites for our study.
Thank you so much, Senator. Any other comments on the selected schools? Any other observation? No other. Yes. Can we hear you out?
Thank you very much. Having noted all the schools that selected for this assessment, like I was saying the other time, that not all LNTG are able to visit all these schools, because there are some of them that were actually stopped at the office of the ES, that they can't just enter any school without the full knowledge. Thank God they are here now and they are really here, so that some of these schools that have been selected, like my own now, I have both the buffer and the main schools. I have the phone number of the head teacher and everything. Thank God for all our guys of the education sector, so that those various areas that I was not visited, they will be able to give orders, so that then our mobilizer will be able to have free mobilization when things that just
Hello. So these are not all those schools that begin flag. How many of them that the LFT will not visit the head teacher? Can we see your hands up, please? Of all those schools that flag up here, how many of them the LFT will not visit the head teacher, will not visit the schools? So guys, can I see your hands up? Anyone? Well, there's one, two hands. This is not how the list of the school. I don't know if the list of the school. Which one? Which one? Which area is that, please?
Actually, we have been to all the schools. There's enough of information of each and every one of each we are able to meet them, right? But they are, what they are saying is somehow different and can be of can reduce their intentions towards this team. That's right. What's from my own, for example, from my own side, what they are saying is that they like to community to raise up PTA. And I told them to go ahead. They have done it, but our sense
Okay.
they are talking about PTA, and I said that's the best way of doing it. And they said they have done their PTA.
And when is the next?
And they are not retention, they are not the next one. Not this time again, they are another time. So, and I told them that we should raise up an emergency PTA.
Where is the ES, the executive secretary for Ashokuta?
You are just left, but he told me that you don't have any group left. That's what 3 Odeda, Abeokuta North, and I think Abeokuta South. They told me that their local government areas, they don't have any challenge. They assured me, few of them there, assured me before they left.
Yeah, I'm good at went off.
Abi, that's it.
I tell you what
Yeah, you sit down and say no problem. But this one, we went to the school.
Yeah, that's that area. I will fit there. I want them facing there that majority of them is here. They are abusers. Let's hear that they cannot do anything to their plan because they know them, they are too come out. So I should ensure that I go to the sector which is in charge, which is in charge of that area. Yes. I went there and sent to answer. Yes.
No, you didn't.
No, but I didn't put you on the topic. That because you are not when we're found meeting that.
No, you cannot make for me because you would have made it.
This one, I decided they don't have
These two schools are the main schools.
Yes. Very close to me.
They are very key. When you can change the chapter, you want to start from it and follow up from. So what are the things now? What are the hello, are we together? Yes, I don't put that on.
No, that one. She thought
So I don't think by now we should have any issue with compliance. We have worked a lot on issue of organization. In our various territories, these are complex. I am disappointed that we are doing this up. So we will resolve that.
yes, hello. Hello. Please one out. Please one out. Is there any school that you listed there that we can visit or there is any opposition or security challenge? Please raise up your hand now and talk. Any school that we can visit or any challenge? Hello, please one out. Let's sit down. there any school that we can't visit because of one challenge or the other? Yes, speak up now, please.
He's here,
Let's listen, please. He said you can look at government, yes. Let's listen to her, please.
Most of the world that we have outside children, and I think that so I've just told you that we fight them again. Probably for so that we have a even for the last 90 years that we it's more or less the teacher
Sẹ́ríkì wá ti sẹ́ríkì tí ó ti ní ìfẹ́ tẹ̀. Wọ́n ní kí orientation of all this ṣe ni wọ́n ti gbẹ́ tó láwọn tó máa ń sọ ọ́ we as a media we know the way people dey so irú àwọn àwọn ìdílé láti lọ tó kẹta ní target sọ́kà kìíní kan tó ń ṣe ní community sí àwọn tó bá ti mú ní ìgbìmọ̀ yẹn máa wá tribe wọn náà sí ní community ètò yẹn ló máa gbé wọ́ọ̀ṣì sílẹ̀ nípa ló bá wọn àbúrò ẹ̀sọ́ wọn you don't just go to there. Àgbọ̀n wọn yẹn sọ. No, we don't hear you.
That's good because it's one of our members. Lead of good supervisor of that worldwide. And I'm the chairman. So we are covered in our we are covered.
There's something I want to observe. I'm seeing that NNTDs are not working with the education sector. I think after this meeting, meet your ears, meet your radio if it applies, and let us harmonize the work that has been done. NNTD is saying that now we visited, but it might not happen. Meanwhile, the education is saying the school is secure. So we need to work together.
You still can't tell until you get to the field. Somebody will let me just cover my ministry.
Yes, I'm not saying that it does not know what is happening on the field together. Because we're all in this together. So please, let's work together.
Just like I hope can make call and the I just finished a review production. The location understand, but I put one out to know what to do. So please to that time, when the person was recording our voice, if I forgot and one of my friends that was in America that don't use his house.
Any question? We're moving to the next.
Can we clap for ourselves for resolving this? The next item, we want to look at the role of stakeholders before we continue. Please, this is very important. Let's see the role of every stakeholder in this program so that we have a smooth and seamless program. Let's be seated so that we don't get distracted.
Cable is coming. Can you name my charger?
No, my Blackberry.
Please let's be seated one house so that we have a very smooth and seamless program. So we'll be looking at the role of stakeholders. And my colleague will be taking it, Mrs. Vera Auguste. Let's put our hands together for her as she takes it.
Good afternoon once again,
Yeah.
Just executive meditation.
I tell you, serious one.
And let's clap for ourselves. And have our seat. Thank you very much. Thank you very much. So I'm going to take us through the roles and responsibility of stakeholders in this impact assessment we are about to start. And what does it mean to be a stakeholder? To be a stakeholder means I have a stake. I'm a shareholder. The success of this activity is dependent on me. And the failure of this activity is also dependent on me. So as a person, knowing that I have something to do to make this activity a success, and I can also do something to make it a failure. So it's not left for me to decide which one do I want to do. In this activity now, this impact assessment, can somebody tell me what you want to do? Do you want us to succeed or you want us to fail? Thank you very much. So that is why we are all stakeholders in this. And one of the aims that we want to achieve is to succeed in this impact assessment. That is why when the issue, and some communities, they say because they want to collect school and urine, they don't want to give because they don't know whether they want to be a. So it is left for us now to be the people to sensitize the community and tell them about the message that they have been taking for long. And this message is not good, that they're supposed to take for life. We are planning to eliminate this disease come 2030. And how to track our progress is by conducting this impact assessment. To know the medicine that we will be taking, whether it has been working, or the disease burden has gone down, or the disease burden is where we met it during the mapping. So these are some of the information that we need to talk to the parents to be able to accept us and allow us to conduct the activities in our. So you can now see the list of stakeholders. We have the Federal Ministry of Health and Social Welfare. We have the State Ministry of Health. We have the Ntds. We have Evidence Action, Education Secretaries. We have the SPEC, NAPS, teachers, local guides, women and youth leaders, and religious leaders. So all these people are going to be working towards the success of this impact assessment, because each and every person that belongs to this organization has a role to play. Next slide. So the Federal Ministry of Health, their role is plan and coordinate the conduct of the digital and escape assessment. That is one of the roles of the Federal Ministry of Health. And from the beginning, we have been with evidence action at the state. Since last year, that was when we started this planning. And by the grace of God, we have come to see the beginning of that. Then ensure and balance the standard procedures. We are not going to be doing this activity anyhow. We have procedures that needs to be followed. That is why after this planning, people that will be concerned will have a training, taking them to training or how to get to the community, how to collect the sample, how to analyze, and also interpret the results. Then capacity building. We are not doing it alone as Federal Ministry of Health. That is why we're going to be having the state participants, the elder people who come and train them and we do the work together. Lastly, we have to share the reports of this survey to the state and the supporting partner, which is Evidence Action, that is working in all the state. Next slide. State Ministry of Health. They are to provide conducive environment at the site of the assessment. Ensure the security of the field team members in the assessment area. Mr. Gideon just asked a question that if you know that any of these schools that have been selected, if we have security challenges, please let us know. The lives of people that are going to be working is very important.
We don't want to put anybody's life at risk. In some places, we've gone, they will tell us that everything is okay. But when you get there, when the team will get to the community, that's when they will be hearing stories. And this road that you people follow to come to this place is not safe. When you are going back, take another route. That is why we are asking this question as we are planning, please. If you know the places we are going have one security challenge or the other, let us know. They can easily reselect another school. Then ensure mobilization of selected schools in LGA. Thank God most of our LMTDs have visited the selected schools. Then provide direction to the LGA. State, we from the federal are going to be working with you. So as we are going to the LGA, you are the one that will give us directions to the LGA that we are going to be visiting. And lastly, provide appropriate health education when needed. We will go to schools and we meet parents in school. I'm telling you, when they know that a team are coming, sometimes parents may decide to go and see what we are doing. And state team, you are now going to be the one to use the local dialect, simple English that these people will understand, and tell them what we are doing. Tell them in the local language what is schistosomiasis, what is soil transmitted helminthiasis. Tell them also that the disease is already endemic in this place and we've been distributing medicine. And please, give a listening ear. They may ask you various questions. Be willing to answer their question and be polite to them. The next slide, LGA exams. They are to lead us to the selected schools. When we get to the LGA, you meet them. They are the ones that will lead the team to the selected school and ensure proper mobilization and sensitization of the selected school. They are also to provide information on appropriate means of transportation to selected school. We are coming back to this. The schools we are going to be visiting, you are going to be telling us whether they are more tribal, whether we need to hire a board for the team that will be going to the school. You are going to be telling us the means of transportation from your LGA to those selected schools. And if you don't know it from here, thank God most of you have visited the schools. So you are going to be giving us lots information. Because we are going to be preparing the itinerary, and these are some of the information that we put on our itinerary. Then also assist interpret the dialect. Then pay advocacy to stakeholders in the school, especially the Parent Teachers Association and the school-based management committee. Please, if we've not done this, as we leave this place today, by tomorrow, try and communicate to the school. Let the teachers and the SNC know about this activity that by the grace of God, we are starting next week Monday. They provide appropriate when needed. Next slide. The evidence action. They are our partners supporting Ogun State. We have to provide funding for this assessment, which they have already done. Then ensure prompt payment of field personnel allowance. Even you that came for this training today, they have to ensure that when you go back, is it not a good thing? So let's give them a class so that they will work on time and pay us. Thank you very much. Then ensure provision of article logistics, that's the materials, the consumables that we are going to be using, and also the transportation, the vehicles of the conveyors to the places. And lastly, assist in ensuring adherence to survey guidelines. Next slide. Education secretary, our ears. We appreciate you for always being with us at any time we call. You know these are your children, school-age children. That is why we in the health facility, we can't do without you. Thank you very much. We appreciate you. That is it, sir. Thank you, sir. You are to assist in mobilization and sensitization of the selected school. You are also to assist in ensuring the safety of the team members as they come to your LGAs and your school. Thank you. And lastly, you have to provide lists of local guides. You know, the teams will be working with
local guys, that when they get to the LTA, those local guys are the ones that will take them to the schools. So you and the LFTD will work together and be giving us names of two persons that will lead each of the teams to the selected schools in your LTA. Then school teachers, they assist in get parents' consent. They also educate the students on the importance of the assessment. Thank God most of them have been taking the message, so it will be easier for them to also explain to them why we want to do this assessment. Then they are to serve as evaluators. In the course of this activity, it's only 2 team members that will be going to the field. The recorder and the sample collector. The sample collector is the one that collects, give the children the bottles, and when they come back, we collect the samples and register their unique ID numbers on. While the recorder will be using the electronic data device to collect the information, we will also need a teacher that will serve as an enumerator. He will be the one that will be writing the names of the pupils on the paper. So this is one of the assignments that the teachers will be helping the team to do. Next slide. Then local guides. Our local guides will lead the team to the selected schools. They will also support in crowd control. You know we are dealing with children, and you know how children behave. Then they are to also support in any other assigned task. There are a few people that are not indicated here, our religious leaders, youth leaders, and women leaders. Somebody said something about youth leaders. You know they are very powerful in the community. They can scatter something and they can also make things to happen. So these are people that we want them to have information about this activity before the team comes to the selected area, so that we don't want anything to be harassed by anybody. Our religious leaders, our parents go and worship with you. You are their leaders and you worship with you. So please, this is an activity that we are bringing to them. We are just soliciting to you to also announce in our churches, in our mosques, that these activities will be taking place, and all we need is the cooperation of parents. Thank you very much, and together we can keep Ntds.
Thank you so much. Any questions for us? Any doubts, comments, clarifications? Thank you so much. So our next item in the agenda is hello, we want the LNTDs secretary to tell us about the school. Like my colleague said, does it need a boat to go there? Do we need a boat? How? We have to read. So we need to know that so that we know the type of
Hello. Don't ask me. We are totally random. But now we need best of information. Hello, one house please. As regards those two selected now we want to, we are looking at how do we get those locations, especially to our entities, and I know that our zonal institutions are here to support us. Now those schools that are selected, I want to inquire, how do we get those locations? Is that the place activity? And when is the activity, how do we navigate the activity? That is the information that is required now. And I will start with Abel Utara. Hello, Mr. Nobi. Mr. Nobi, are you there?
Go to another again.
No, let's just go to this. Start from the first one, huh?
For Abel, main schools are, we have every place in one. Now let's listen now. For those in our presentation, we have presented the clusters whereby for each of those regions that will be taking samples. Now let me start with Abeokuta. For Abeokuta, for Ogun Central. For Ogun Central, we have two locations. One will be in Ifo, one will be in Ifo, that is General Ifo. And that one will serve Ifo, Ewekoro, Adojota, and yeah, those are the three only three. Then the other one is at Buna, that's Federal University of Agriculture, Abeokuta. And that one will serve Abeokuta South, Abeokuta North, Odega, and Obafemi. Now, what I want us to do is this now. Now, from those schools now, let's take another sample in Abeokuta now. Where we will go to that school, what will be serving from that school to our main laboratory, and the lab center is what that school now. That means we are navigating between the center of the place where the school is situated to Federal University of Agriculture. How is the area? How is the opportunity? Now, let's look at the transportation, where the school is located and where we are going.
Are we using both?
Not the blue. Where the school is located is really are you going to have any challenge? Where the school is located to Federal University of Agriculture. Hello, let's look at those schools. We are
so marketer tó bá ṣe ló máa gbà ẹ̀rẹ̀ nínú ọgbọ́n máa lè rí ẹ̀rẹ̀ ní ṣe ní ṣe báwọn ọmọ yẹn ká marketer yẹn kò dé ìgbà tó máa yẹ kó kúrò sàìsàn ọmọ ìbáraẹni 10k later they go to 20 present is 33.
So before you give us the distance, right, I just want to let you know that since the education focal point and the LFTs will serve as local guides, right? For each field team coming in, there will be a vehicle provided. So the LNTD and the education focal point will tell us a meeting point and we pick you up from that point and move head straight to the school. So in each LGS we have two sites. The NNTD will support one site while the education focal point will support the second site. And for both sites, we have one vehicle dedicated to each side. So you will tell us meeting point and arrival, take off, then we take off to the school. So for this exercise, what we need you to do for us is to confirm to us how many hours it will take us to get to the school, then from the school back to the lab. Abby? Yes. Just tell us if it's kilometers, if you don't know
2 hours.
if it's 1 hour or 1 hour.
30 minutes, 1 hour. That's all. Hours, minutes.
1 house, 1 house. So let's start with people.
Hello. Our next today is statement of commitment. Yes. From the evidence action, the state, the LFTD,
Hello. Hello. Yes, for this agenda, they have launched the first statement of commitment. Okay. So now we go to launch. There's a question here.
Sorry, we are narrating we'll be giving out tickets so that you not be loud. So some few people will just go after they have been taking the others will follow. So that you will be loud.
I just want to ask this question. It's a question that I'm sorry for taking us back. The question is, after parents has allowed their children sample to take, and the sample has been tested, will there be feedback like individual learners that their samples have been taken, so as to know, so parents want to know if the sample they have been taken is positive or negative. That's something will be there. The feedback will be given directly to those learners. Thank you. Hello. Please. asking if there will be a feedback for people that are listening. The children we are testing is representing the local government area. So if you do well, every child will be treated in that county, not even the child alone. Because this is public health. It's not about the child alone. The child is not representing himself, he's representing the children of that local government area. So in all that we do, there must be feedback. After this survey, we'll get to the state. So we'll get from the question, there will be feedback, and the result of the feedback is treatment of all the children in that local government area, or we stop treating if we don't find anything. Thank you so much. So we are here to do the statement of commitment, starting with our dear partner, Evidence Action. Please come over and give us your statement of commitment once again.
Very funny. Very funny. Every 3 months,
We want to use this opportunity to appreciate all our stakeholders present today. We, as Evidence Action, we are also committed to ensuring that all stakeholders receive their payments timely, and we would ensure that the support you need for your mobilization and for any other field activity or tasks assigned to you as a stakeholder will be well taken care of. I think that's all.
Thank you.
Thank you.
State Ministry of Health.
I would address it. I believe this assessment will be a successful conversation, provided we have the support of our education secretaries, provided we have the support of our zonal officers from the 4 LGAs, provided we have the support of other stakeholders there present, Lima Links, AMIS, NAPS, and so on and so forth. Can we have a representative among the education secretary to give us their statement of commitment, and also a representative from government education authority to give us their statement of commitment, a representative from media, because we need to disseminate this information into LGA, a representative of NAP to give us the statement of commitment. Shockingly, 1 minute, 2 minutes. Who is representing education secretary?
want to assure you that all the
tó bá bẹ̀rẹ̀ fún yín.
ìyẹn dẹ̀ sún ìkan tọ̀dọ̀ ní ló máa ń ṣe bẹ́ẹ̀.
bó ṣe wà yìí bó ṣe ṣí data Regina.
èwo ni ẹ.
I want to assure the Ministry of the Ministry of Education, Science and Technology.
ilé máa sọ gbọ́dọ̀ rọ mídíà.
No, la vez o no, I'm ready to support them now. Okay, bóyá máa ń ṣe ọ̀rọ̀ pé yàrá ní káàdì báyìí.
ọmọ bá sọ̀rọ̀ straight láti yẹn gbọ́ mo lè bá ń ṣe sọ mo lè.
ẹ kàn sọ fún pé padà life attitude padà pẹ̀lú ọ̀rọ̀ owó yìí. àti gbà kẹ́lẹ́ ta lọ bẹ́ẹ̀ ó dẹ̀ rí owó yẹn orí ọtí náà ni tẹ bá fẹ́ ka wọ́n níbi àpàlọ́ wọ́n níbi ẹ̀mí ọ́fíìsì wọn yẹn láti bẹ̀rẹ̀ bá ti gbà gáàsì.
Ready to serve as a monitor.
Thank you very much, sir. PTA, àwọn alọ́mọ.
Èmi àṣàkẹ́sẹ̀ máa ń ṣe ọ̀pọ̀ bí ṣe ṣe fọ́fẹ́ fún ẹ̀mí mi ìgbà lọ nípa àwọn olójú kan náà wà lẹ́gbẹ́ máa ń gbá sọ́wọ́ láì mi gbá púpọ̀ láti ṣùgbọ́n ilé iṣẹ́ tó bá ti fún mi fọ́ọ̀dù ní jẹ́ pé ó pé everybody mo lè gbà á sí tó sì fún 5,000 láti lè kí fi ṣe presentation fún ní àti ẹ̀kọ́ chances.
Because many now and they are compliant. I'm sure this one.
Are we all good to go?
Yes.
Lima, never was a remember.
Owó yẹn náà ju 10,000 bọ̀ ní ibi tó ti ń bọ̀. Àjù rẹ̀. Mítà tí mo lò lè nígbà yẹn lórí àwọn aṣèlú mítà.
OGBC tiwantiwa OGBC tẹ́bá wa sọ́lẹ̀kùnrẹ́rẹ́ ni ìtọ̀ àti ìgbẹ́ta fẹ́ gbà a fẹ́ ṣàyẹ̀wò ní o òkè ìgbọ̀nsẹ̀ a fẹ́ ṣàyẹ̀wò ní àfi ṣògùn owó àdẹ̀fídé community wò ẹ ṣeun.
Well, like we've been doing for you, whenever you call on us, definitely we give you the support. But you know what to do. So I won't say more than that. But we will see what we can do for you as well. God will help us.
Hello, our mama wa.
Done it up. Yes, please speaking on our behalf now.
Private lady.
All protocol duly observed. Like you said earlier on, we've been a partner in progress, and by God's grace we will continue to be. So I want to say, if there's still going to be a way tomorrow, you can just add your way to our station for public enlightenment.
SMO, public enlightenment. Ẹ pàtẹ́wọ́, ẹ tún pàtẹ́wọ́, pàtẹ́wọ́ lórí ilẹ̀. Ọ̀sẹ̀ ló bá gbé òkú.
Ẹ sọ fún pé ẹ má pretend for sọ fún straight.
So let me, Mr. Before we go for our lunch, I appreciate everyone.
Àní máa kọ́ tẹ̀ ìwé ni ó máa bẹ̀rẹ̀ kánà fún ìdárẹ́bù máa máa dé fún mi. Ìyá àfọlọ́ bá gbé kọ́ọ̀pù mọ́ọ̀dù lọ́pọ̀ orúkọ wá sí. Ebi ò tiẹ̀ mú. Ṣègbọ́dọ̀ pàtàkì lẹ́yìn àdúgbò ìyẹn kò bú sẹ́rìn wọ́n kì í ẹni òṣì ṣẹlẹ̀ jábọ́lá torí sẹ́ńtà tó ní òṣì ìjọkọ̀ ọkọ̀ pàtó tó wà bá yọ parí ọ̀la rẹ̀ lọ́kà wọ́n pè é máa ṣe wọ́n á pè ọ̀rẹ́ mi yẹn pé ṣé ti wo mọ́ ìgbẹ́ wá ní nǹkan jù lọ onígbò lọ́rọ̀ ìyẹn wá rẹ́rìn pé bá jáde gbà ọ́. Kí bá ti rí ìjìnà wọn bẹ̀ ìjìnà wọn ní 551 ní 5 litres ìró àti fún ìṣẹ́mù.
Kí ló máa fi àṣẹ tẹ̀lé ọ̀rọ̀?
Ṣe rí ìṣẹ̀lẹ̀ kọ́tẹ̀ máa ń ṣe ẹ̀mọ kọ́tẹ̀ máa ń ṣe tó bá gbá mi tó bá mọ̀ kó gbà àwùjọ òun ló fi náà ṣe tó bá ti wá rí opportunity láti sign line ẹ̀ máa pọ̀ ju ẹ kúrò ní ìparí ọ̀sán. Irọ́ yìí.
Sọ pé mi fẹ́ ṣe é ti lọ pé mi fẹ́ nípa mo ṣe bàyẹ̀ mi ò dáa bẹ́ẹ̀ ṣe ló gbá mi tí mo dáa tí mo bá ṣe ló wẹ̀ tó bá kàn dá máa kú lọ́wọ́ padà tó kù tí mo ti kú máa
Ẹ̀rí pé kò ní ta sí kò ní wá. For 3
Thank you so much. Can we clap for her, please? So, now time for lunch. Go to 10. I think it's yours.
Probably to believe in example, he always puts money in bonds, and then he goes to buy. Doctor, I like the use of friends.
We'll go the first 10. Check your number. 10, 20, 11 to 20. Just like that, here we go. So the first 10, please go there. If your number falls between 1 and 10, please get there. If your number falls between 1 and 10, please get there.
At 5,000, no way you take me.